Good morning. Welcome back to Good Samaritan Facebook Live. My name is Dr. Scott Stine. I'm a family physician here in Vincennes, Indiana, and Chief Medical Officer of Good Samaritan Physician Network. With me, as usual, Adam Thacker, who is our Chief Operating Officer of Good Samaritan Hospital. We will be giving you our usual weekly update on status of COVID-19 in our community, kind of where we've been over the course of the past few weeks, what we're looking forward to, some of the changes and recommendations that have come out from the CDC regarding masking, which is kind of interesting. We'll touch on that just briefly. I think our active weatherman, Adam Thacker, will be giving you a little update on where things will be going with our vaccine clinic as well. So just to lead off with total number of cases from the beginning, a little bit over 3,500. Most importantly, when we look at the numbers, the unique individuals and the 7-day all positive rates, things continue to get better. When we look at all individuals, it's around 4.7%, and the unique individuals about 14.5%. And those numbers continue to trend downward. We've seen across the state things have looked better. We've had a little bit of a blip back up with a few of the counties, but in general, the numbers continue to look better. And probably one of the more interesting things when I kind of looked back at the trend of the graphs, if we look back at the death rate, the number of people per day, this is the lowest we've been at since back in the summer, which is pretty remarkable. And I think it speaks to really what we've been hoping and anticipating and seeing over the course of the past month or so, which is we've seen less cases overall, less severe cases overall. Those cases that we were concerned about being more severe, we've treated with the monoclonal antibody infusion, therefore less active cases being admitted to the hospital. So all of those things have continued to look better.
Yeah, we continue to see good news, and as you mentioned, I think that it's multifactorial. I think that monoclonal antibody therapy has had a dramatic impact on our ability to keep patients out of the hospital, which is great. Certainly the vaccine rollout has had an impact as well. And then also, I believe that as we moved into this flu and cold season, our own communities really embraced social distancing, masking, staying out of large crowds, and we've become more accustomed to being able to do that. Thus, the reason we've seen other viral infections really drop off. So it's not just that we have had treatment and vaccine for COVID, but we've seen that effect across the board, and hopefully something that we'll continue to see as we're now much more educated, or at least more aware of what causes viral transmission and the importance of hand hygiene, distancing. You mentioned masking, so let's just tackle that one. The double masking.
How many masks is it? 10 masks, 3 masks, 2 masks?
I think what gets missed, and so many times in media, there is you hear something and the headline becomes, now we have to wear 2 masks. So we have to wear a surgical mask and a cloth mask over the top of it. If you read the actual guidelines, it's all about having a mask that fits. So you can still wear one mask, but it's about that mask fitting your face properly and wearing a mask properly. So we don't have to go through the show and tell, but wearing a mask below your mouth and nose does not do any good. Your chin is not expelling virus. So wearing the mask over your nose and mouth, and then a form-fitting mask to where you pull the ear loops tighter to where you don't have these big pouches on the side where air can come in and out. That's why they said the second mask is to make that fit more form to your face. But that's really what it's about, is having masks that fit appropriately. We don't have to move to N95 or medical grade only mask. It's just about wearing a mask properly does the trick.
And certainly one of the things Adam mentioned, which is really important, is just having things adjustable. I know early on I found a series of masks that had a little rubber grommet that goes across the ear strap. We use those for ourselves. We use those for our kids. They're much more comfortable, but you can also adjust that gap that occurs around your cheeks. So really what they're talking about is if you have a mask that fits well, you don't need to wear 2, 3, 4, or 10 extra masks. It's just making sure that you're wearing it, number one, you're wearing it appropriately, and it's fitting appropriately as well. So that's really our message to everybody is, as Adam said, people latch on to headlines and things get kind of exciting, but really it's all about just wearing your mask, wearing it appropriately, and making sure that it's adjusted appropriately also. And you mentioned one of the things that has had an impact. I'm absolutely blown away by the number of vaccines that we have been able to give over this period of time. Would you give us an update on numbers on that?
We're now over 11,000 vaccines have been administered since December 17th, averaging about 350 a day. And we continue to see as eligibility moves, which we're still at that 65 years of age and older healthcare and first responders, but we've went from 80 to 70 to 65. Some anticipation this week that the state will announce that 65 to 60. So that opens up another pretty large group of Hoosiers that will be eligible, and then follow the same process, ourshot.in.gov to register. You can call 211 to register. Certainly this week, there are some challenges with weather, and so patients that have an appointment today we're moving up. Typically, on a Monday, our clinic would run 9 to 5. We're moving everybody up before 3 p.m. because that's when the anticipation of heavier weather is going to hit. As we all know, weather can be difficult to make the most accurate assumptions on, but we're moving everybody up before 3 p.m. And then those that are scheduled tomorrow are also being asked to be able to come in today, get vaccinated, and then anybody that cannot, we will reschedule. I think around the vaccine, everybody has a heightened awareness of, if I come to the hospital, I get shot 1, I have to get shot 2 on day 21. Just to clarify, the 3-week gap is the recommended dose. That's how it was studied. But there is a grace period, if you will, and CDC, which we follow explicitly because that's where the guidelines go through. That's where the Advisory Committee for Immunization Practices is based out of. They have said that second dose can be given up to 42 days after the first dose. And the studies actually still show that the same immunity, same efficacy is tied to that. So 42 days from shot 1, hopefully we won't have 6 to 10 inches of snow coming in 42 days, and we will be good to go to be able to get that administered. So I put that out there to make sure that as individuals are thinking about my second dose may get pushed off, don't worry about the fact that that's going to cause some lack in efficacy or the vaccine not working appropriately, because it has been studied for that period of time, and certainly we will get it rescheduled as soon as possible. We'll probably be more in that 24, 25-day range, certainly not outside of 42.
And we certainly don't want people to put themselves in a bad situation as far as safety to come in and get the vaccine. So generally, with almost all the immunizations that we perform, pediatric and otherwise, it's as long as you don't get it early, things are fine. And so we will push past that date, and once things clear as far as weather is concerned, get things caught up, get people back on track. But please don't get yourself in a situation where you're unsafe as far as travel is concerned to come in and get a vaccine. The other thing that we talk about, we want to encourage people to make sure that they stay in contact even during these difficult times as far as weather, is if you are positive, if you have not received the vaccine, or even if you have received the vaccine and you're in a high-risk category, we want to know about it so we can administer the monoclonal antibody. We've had tremendous success with this. As Adam had said, one of the things that we really think has been a contributing factor in keeping some of our highest risk patients out of the hospital has been the monoclonal antibody infusion. And just to kind of run through what that process is, when patients develop symptoms, we want them to get tested. We want that testing result back as quickly as we can, so we do the rapid test on those individuals. And then depending upon what risk category those individuals are, based on their age or their medical problems, we determine if they're a candidate for the monoclonal antibody infusion. So one-time infusion that you receive in the outpatient section of the hospital. And what we have seen over the course of a little bit over 360 doses that have been given of that, so we've had very few individuals after receiving that infusion that had to be admitted to the hospital. Our statistics here have been significantly better than even what the initial studies showed on that. So we've been very encouraged that it's very effective, and we want to make sure that people still understand that if they've gotten the first vaccine, if they've gotten no vaccine, and they develop symptoms and they get tested and turn positive, we want to make sure if they're a candidate for that we get that performed as quickly as possible. As far as kind of where we go from here, many people are asking, lots of opening as far as a vaccine is concerned. So we went 80 to 70 relatively quickly. We went 70 to 65 a little bit slower. And the big issue with that, of course, is the volume of people that are within each of those groups is larger. So a lot of people have asked me, why is this not a little bit more regimented in terms of 80 to 70, 70 to 60, so forth? And it's because we're talking about the populations that are within those groups. So when we were talking about the 80 and above population, that was a smaller group than the 70 and above population. And the thing that we're also eagerly anticipating is kind of where we go from here in terms of individuals with chronic medical problems and how that pertains to this.
Yeah, and there was some announcement from the state vaccine planning group that would be next. So as you mentioned, it gets back to just age-old supply versus demand. And we would take more vaccine and give more appointments availability. So, we keep asking for more and more and more. But right now, that 70 to 65 was about 500,000 Hoosiers statewide, and then 65 to 60 is another 500,000. So after it goes to 60, the age-based piece starts to tail off, and we start looking at high-risk individuals. So what has been announced is after that 60, which we don't have exact time frames, but probably end of February, early March is realistic. We'll start looking at high risk, age 50 to 59. And when we say high risk, they've identified heart disease, lung disease, so COPD, CHF, diabetes, those types of illnesses that we know are the highest of high risk for severe illness with COVID. They have also announced a less than 50 group that is a smaller section of Hoosiers that will go live at that same time when that is announced, which is dialysis patients, solid organ transplant patients, active cancer patients, or cancer patients that have been in active therapy within the last 3 months. So all of those. So why those groups? Because I'm sure there are other disease states that put individuals at risk. We know that, but those are the highest of risk for morbidity, mortality, so poor outcomes with the illness. It was announced by Dr. Weaver, who is the chief medical officer and leading the vaccine planning across the state, that once that 50 to 59 went live with that high risk, that would now represent over 95% of hospitalized patients for COVID since the beginning. When you look at 50 to 59 high risk and then that 60 to 80 group. And that's really where the focus has been, is preventing death, preventing hospitalization. So we've got our first responders, healthcare team getting vaccinated, and then we've got our highest of high-risk community getting vaccinated. So that's the best model to use data. There are certainly advocates for essential workforce, and those are very valid aspects of who should get vaccinated when, and it's a polarizing topic for sure. But in using data to drive the decisions, you have to look at who's taking care of the most vulnerable and who is the most vulnerable, and that's really what the process is.
Yeah, really, when we have looked at, and the longer that we have been going through this process, thankfully, the more data that we have, and really from early on when the dashboard was created, we had a very rich environment for gleaning that data to say what individuals were being hospitalized, what were their age ranges, and although it seemed kind of arbitrary that we're just going to do it based on age, that's really what we saw in terms of hospitalizations as far as deaths are concerned, and then that's why this is basically trickling down based on age first.
Right.
And then what Adam mentioned about those special groups that will be opening up, really that has everything to do with immune system functioning. So when we talk about active cancer treatment with immune suppression, when we talk about solid organ transplant with immune suppression, when we talk about chronic kidney disease, dialysis, those patients are immune suppressed as well. So really it's people with not normal immune systems that we will be talking about kind of in those next groups. There are lots of patients that have immune suppression because of their other disease processes, but not as severe as what those particular groups are. So we'll be keeping you updated on that as we go over the course of the next week or two, but realize that that's all rolling pretty quickly. And really, if we look back a couple of weeks or so, the allocation for vaccine was looking a little lean, and really they've come through with a much better allocation for the states. Things are looking better as far as Indiana, and therefore rolling down to Knox County as well.
And there's a little bit of a tale of two stories, if you will, in that health departments across the state have been given the Moderna vaccine, as well as long-term care facilities and their partnership with CVS and Walgreens. And the Moderna vaccine, there have been a very, very tight supply, even to the point that some vaccine appointments have had to be canceled because they didn't have enough vaccine. On the hospital side, those initial 45 to 50 sites that went live that were part of hospital systems that have ultra cold storage capability, we administer the Pfizer vaccine. And the Pfizer supply has been more consistent. we've stayed ahead of the curve. Certainly there are some days that have been a little tight and have been worrisome, but we have not had to cancel any appointments. We've been able to maintain a steady stream of supply that meets the number of appointments that we have today. Now, certainly, as I mentioned before, we'd like to increase that and see more come in, and that's not happening yet. But I know there are, across the country at a federal level, there are discussions of how to get more vaccine rolled out in a quicker fashion, and hopefully we will see that come down the road.
So as we move forward, we'll continue to keep you updated on what the time frame is going to be as far as those releases. Dr. Weaver, as you said, basically those decisions are being made right now as to what the timeline is going to be, and then there's meetings basically where we're updated on what those are, and we'll roll that out to you from there. Besides weather updates, any other things you'd like to talk about before we go to the phones?
No, we can see what questions. The only comment that I would make, just kind of reiterating on the weather, stay tuned to our Facebook here, as well as if you are a patient with an appointment and that appointment is being changed by us due to weather, you will be contacted. Don't call the clinic and ask, is my appointment changed? Because we'll make sure to get that notification out. As we're moving people around and trying to move up in front of the weather, the clinic, especially the vaccine clinic, is going to be extremely busy. So calling is likely not to be a phone call that is answered. So just monitor our Facebook as well as our system. If we change your appointment, we'll automatically notify you.
All right. And as far as the outpatient offices that we have, patients that have appointments, we will continue to have those appointments throughout the day today. Ultimately, we'll be trying to call and move people up as well. So if you have appointments, plan on those appointments to continue, and we'll be in contact with you throughout the day and over the course of the next few days. Tiffany?
Okay, right now I have one question. If you have been fully vaccinated, would it be okay to have out-of-state visitors in your home?
Yeah, so I think what we consider to be fully vaccinated is once you have had your first vaccine, your follow-up vaccine, regardless of which one you have received, and then a couple weeks after that, really that's what the studies looked at the best statistics on. So whenever we look at what does that do for you, well, that provides you with immunity, and then any individuals in your house basically are considered to be immune. We want people to be smart about what their travel habits are and who they bring in because of what their exposures are and how that's going to be potentially risky. But yes, in general, when people get to be fully vaccinated, they're protected, their family is more protected, travel becomes more safe, visiting family members becomes more safe. The population, though, the question that I get most frequently is, can I go to sporting events? Can I see my grandkids? Can I do those types of things? And it's important to realize that that population that we're getting vaccinated, as Adam said earlier, is that highest risk population. That doesn't necessarily mean that my kids aren't going to get it or your kids aren't going to get it or other individuals that are off of that scale of vaccination that we've had so far. But those individuals that we're most worried about, yes, I would say that that is okay.
Yeah, so 2 weeks after second dose, regardless of the vaccine, you're considered fully vaccinated, and recent release was that means you don't have to quarantine, you're considered vaccinated. I guess the word of caution that we would want to plug into that is understanding the risk for those individuals coming in. So when you're talking about out-of-state visitors, are they in high-risk categories? Have they been vaccinated? Do they have any symptoms? Is everybody going to mask? And if they're coming to your home and likely out of state staying, probably not going to be wearing a mask all the time. So just considering those aspects of it, because what still is kind of hanging out there, and there's theories being proposed, but we don't know yet, is once you've been vaccinated, if you come in contact with the virus, can you transmit that to somebody else? So if those out-of-state visitors are in the high risk categories of potential illness and have not been vaccinated, then certainly proceed with caution. If they are in lower risk categories, and if they've been vaccinated, absolutely, the risk is extremely low.
Really, one thing that families have done an excellent job with is kind of identifying what their circle is with individuals that they've been within. And that, I think, has helped us a lot. When we had everything locked down, everybody isolated, it was challenging for everybody for a variety of reasons. But people really, over the course of the last several months, have said, hey, this is the people that I'm in most contact with most commonly, and stayed within that circle. And I think that has reduced risk quite a bit as well.
If your out-of-state visitors are from the South, you may want to go visit them for a week.
Absolutely. Starting now.
Someone asked about a caregiver that is a resident of Tennessee but has been here since October taking care of an elderly mother. Can that person get their vaccine here?
So the answer is yes, if that caregiver is taking care of somebody and would fit into the category of a healthcare provider. So healthcare provider, obviously we often think people that work in a hospital, people that work in a medical practice, in community pharmacy type of settings, long-term care as very black and white healthcare providers. But also within the definition from the state of healthcare providers are caregivers that take care of another individual on a regular basis and are interacting with them as their healthcare provider. And they are eligible based off of the work, so to speak, that they're doing, not their county of residence. So in that case, if this is somebody from Tennessee, but they are here taking care of somebody and are their medical provider, so to speak, and their health caregiver, then they are eligible.
Okay, someone asked, I guess for their job, they're being tested every week. Now, after they get both shots of the vaccine, should they still be tested every week for COVID?
So from a clinical standpoint, that approach doesn't necessarily make a lot of sense, but from an employer standpoint, it does. And so we have to respect the fact that each individual employer is going to have policies in place such as that, and likely that will need to continue. One of the things that Adam just alluded to, which we don't know the answer to yet, is the issue of can I be a transmitter of virus even though I don't have the infection itself, meaning that I'm not ill with it. And we don't know the answer to that, and those studies continue to be ongoing. So I think the answer to that is whatever the policy is for your workplace, absolutely, you have to continue to do that. Now, one of the things that we are offering up to people to understand, and this will be kind of workplace-based as well, is once you have received your 2 vaccines, it's been a couple weeks, and you are considered fully vaccinated, generally we consider that if one of those individuals has an exposure, they should not have to be quarantined during that time. That's fairly universal that we all agree upon that. And that's one of the major benefits is, people are worried that they can't work, they can't continue to take care of their families and provide for them. And so one of the big benefits of getting vaccinated is if you have that and you have an exposure, you don't have to be quarantined after that exposure if you've been fully vaccinated. Now, of course, we want you to continue to mask, use all the same universal precautions, but you don't have to go into quarantine after an exposure once you've been fully vaccinated.
Okay, and kind of to tack on to that, one of the questions was does getting the vaccine keep you from getting COVID-19 or spreading it? But you did mention that part. So what about keeping you from getting it?
It does not. So the vaccine works, and when you hear efficacy, I think immediately we kind of turn to that means I'm 95% protected from getting the virus. That's not how it works. The 95% and even the 100% are tied to clinical illness, severe illness, hospitalization, and then that 95% is even mild to moderate illness. So you can still come in contact with the virus and you will still test positive for the virus, but the clinical illness and potentially needing hospitalization, getting sick, if you will, is what the virus protects, or what the vaccine protects against the virus. And then that looming question that scientists are trying to answer through research is, if you're asymptomatic, you've had the vaccine, can you spread the virus, which is still being studied, and we just don't know enough yet. But you can still test positive. We've actually had a number of individuals go through the clinic that have then called because they've tested positive, and that's perfectly normal, but they tested due to either routine testing at an employer or they were an exposure, so out of curiosity went and got tested positive, but they felt fine.
Right.
Okay, that looks like all the questions we have for this week.
All right, very good. Well, thank you all very much for joining us this week. Stay tuned for our updates each week. And as Adam said, please check in with our Facebook page. We'll be sending out alerts as we go out throughout the day with regards to what's happening with the vaccine clinic. And then again, if you have appointments scheduled right now with your ambulatory offices, plan on keeping those. If you're going to have a challenge getting in, please call and we can get those switched over to virtual visits. But we will continue to provide that care in the best manner we can, in the safest manner we can. Thank you.